skills, promote evidence-based practice, and bridge the gap between research and its real-world impact. The theme for today's session, Bridging Research and Impact for Global Health Equity, is particularly significant. Research is not just about generating data, its true purpose lies in driving meaningful change, shaping policies, and ensuring better health outcomes for the communities worldwide. To lead us through the discussion, we are privileged to have Dr. Pablo Estrella as a speaker. Dr. Estrella is a distinguished medical doctor from Ecuador with a master's in public health from Spain's National School of Public Health. He is currently in his fourth year of public health and preventive medicine residency in Valencia, while also pursuing a PhD focusing on vaccine-preventable diseases. Beyond his academic and clinical work, he holds key leadership positions, serving as chair of the Juniors Doctor Network of the World Medical Association and coordinator of the AMR subgroup in that network. Additionally, he is the chair of the Quadripartite Working Group as on youth engagement for antimicrobial resistance. With his extensive expertise in public health, research, and policy, Dr. Estrella brings invaluable insights into how we can effectively bridge the gap between research and its practical applications. I'm confident that today's session will be insightful, engaging, and thought provoking. Without further ado, please join me in welcoming Dr. Pablo Estrella. Okay, sir.
Simran, thank you so much. It's a real pleasure for me to be here. Let me just quickly share my screen. And please confirm that you can see my screen. Yes?
Yes, sir, it's visible.
Perfect. So I'm really honored to be here. As I was kindly introduced, I'm Pablo Estrella. I'm a medical doctor, currently living in Spain, even though I'm originally from Quito, the capital of Ecuador in South America. When I was proposed this topic, I really liked the idea because I know that many of the profiles in medical school, or even many of you that might be on your last years of med school or have already graduated, are on this pathway of research. And whenever we think about research, many times we are just focusing on the output, but we barely have this kind of spaces for actually giving a step back. So today's session is going to focus on this special bridge of research and the impact that we can have with it on global health equity. So to start with, I would like just for us to imagine those who have already done some research in the past or have seen it in any of your rotations during your undergrad years. There's a lot of efforts, time, and resources that is invested in research. But unfortunately, there is a huge gap just until those research papers and outcomes actually are applicable into clinical practice, and not even to tell how big is this gap when we are talking about marginalized populations or other sectors of the world, especially low and middle income countries. That's why it's really important to have this perspective whenever we are in any stage of the research cycle. But wanted to tell you that this is something that is not just happening in lower and middle income countries, as it's the case of Ecuador, for example, but also these important gaps also happen in other countries such as Spain, where I'm actually living at the moment. So the idea of today's presentation is to briefly introduce you to some of my experience with the research and also my background on the global health field. So to put you into context, it's important to ensure a research doesn't end on the publication as the ultimate goal, but actually to drive action. Our goal is to be aware of this gap that we were describing before, and also learn throughout our medical career and our undergraduate and postgraduate training on how we can drive action through policy influencing, improving practice, and advancing global health equity. So the idea that everyone everywhere deserves a fair chance of health. So Ecuador, it's a small country in South America. It's in between Colombia and Peru, with 14 million people. So as many other low and middle income countries, we face some common common barriers, such as the limited resources that is invested in healthcare, as well as a healthcare system which is not necessarily fully integrated and is actually quite fragmented in between the public and the private sector. And also that research, unfortunately, is not on the top priority list of health. Why? Because as you can imagine, having this background situation does put research on a secondary position. Regardless, still, research can be a key element for advocacy and actually doing great public health work, as we will see today. Also, as I was introduced, for this year, I'm the Junior Doctors Network from the World Medical Association Chair, which is the organization that represents junior doctors from across the globe. This experience, and I've been also in the management team position for already 3 years, has gave me also quite some interesting insights on how global health works, and especially how we can do this translation from evidence into policy action. So the first example I wanted to bring you is one that actually happened once I moved to Spain to do my residency. So now I'm in my 4th year of preventive medicine and public health here in Spain. And as many of you might be aware, or probably will be aware soon, resident working conditions is always a hot topic, even in high-income countries. So when I arrived to Spain, I also joined the National Medical Chamber, where I'm also a part of the external representation from their junior doctors. And they had this idea of setting up this countrywide survey where they wanted to assess what were the working conditions from residents over the country. And this was really key because you know that residents over time have complained a lot about working conditions, but it wasn't really much tangible because it was a lot of experiences, but not really hard data. So back in 2020, a group of junior doctors decided to start gathering this information. And when I joined in 2021, I was part of this research project. So what was the output? We managed to publish back in 2023 the first countrywide study of resident physicians' duty hours, the resting times, and the compliance of the European Working Time Directive in Spain. This study was quite unique on its type because it's true that in literature there is no much regarding resident physicians' duty hours, as well as the compliance with the European Working Time Directive. So just wanted to bring you some of the numbers we published in the Human Resources for Health journal. And actually, since it was published in August 2023, we're still on the 98th percentile of this journal compared to other similar manuscripts published. But what this manuscript bring into evidence? So this national study showed that 80% of residents were working beyond the European Union weekly limit, which is 48 hours, and also more than 13 got no rest after the 24-hour shifts, despite regulations. So this information is relevant. Yes, we finally were able to put the different complaints from residents into paper. But what happened after that? One option would be, great, we have the document published, let's go to the next one, right? But as we were in a structure of junior doctors who were super motivated, and we also had the support from the National Medical Chamber, we actually were able to take it further. So as you know, many times the final paper or the final manuscript is not as easy to understand with all the research terminology, and probably it won't have as much outreach to general public or even to the media. So what we thought is breaking down all the results from the study, and actually we created a much simpler version of a report from the National Medical Chamber in name of the junior doctors representatives. So we twisted a bit the results in a way to, instead of putting odds ratio and other kind of statistical data, we create a ranking, right? And we created in this map also which were the provinces in Spain which were less compliant with the European Time Directive. And actually, we created this rank between the different provinces of which was the provinces who was performing the worst. So as you can imagine, this actually gathered a lot of attention from media. We did the same with the ranking with the specialties, where we actually were able to rank which specialties were performing worse at complying the European Time Directive and which ones were better. So this brought a lot of attention. Actually, the media was really interested in this topic, and we were able to escalate this even more. So what we did is we realized that there was a big advocacy opportunity where basically we took it also to the politics. To the policymakers. So through the National Medical Chamber, we were able also to put a request to the European Parliament, as Spain was not compliant with the European Time Directive. And of course, it was really needed to have this kind of hard data. And since then, actually, we've seen that and there has been some changes in the current situation of working conditions. But this just didn't stay on the national level. So there's this other organization in a European level, which is the European Junior Doctors. As Spain is also part of it, it was taken, these results, all the advocacy work, all the media impact, and it was also taken into this European context. And therefore, it was launched a few months ago from the European Junior Doctors organization, whole European study where it's now evaluating the current resident working conditions for trying to have a first type of study which kind of set a baseline of what's the current situation of resident working conditions across Europe. So this is quite interesting also to show how one research paper was not just taken or left as a manuscript per se, but actually we did these different steps for all the advocacy on the background. But one step further that also we promoted was that in a local level, what we wanted is, as we had the national database, we wanted to support also those provinces to have some more local action with this information. So this is also another example of a study that I was honored to support from Valencia, which is the province where I'm living. And what we did is to use the baseline data from the original study and doing a second phase study, we were able to then replicate and make it more focused on the current regional situation. This allowed us also to make a ranking or a rating of how different hospitals in the region were performing when we were talking about compliance, as well as specialties. As you can imagine, this has quite a big impact in media, but also on the tutoring system from residents, as this was also the first time that a study with this groundbreaking information was put into hard data, because before it was really perceived that residents were just complaining, and that before some years ago it was even worse. So also bringing this data into action was a great example of how you can take this into closing these gaps that there exist when we're doing research. But it didn't stop there. So situation in Spain has still been escalating. Even though some improvements have been proposed, still some regulations are being changed. So what happened from the side from the World Medical Association and the Junior Doctors Network, we received a request also from the Spanish Junior Doctors showing what was their current situation. So we did also a small research of what was the current status of the Spanish junior doctors situation, and of course this kind of research helped a lot to understand the context, and we deliver a statement of support for the Spanish junior doctors to support the different strikes they're having at the moment. But not just that, but also the impact on how we were presenting also the information. Of course, we were using the same reports done from the studies for bringing actually the hard data. And I'm just bringing this here because I wanted to highlight how important it is to actually be able to access this data and actually utilize it in different advocacy initiatives. And of course, as junior doctor representative from the Junior Doctors Network, this is one great example that I wanted to show you because it's really close to me as a junior doctor living these different situations. But there's other ways in which you can also engage on research and this policy action. And one of them is also working on policy briefs. So to give you some context, as part of my residency program, I also did a rotation of 4 months at an organization called REACT, which is Action on Antibiotic Resistance, which is a network that is located in 4 different regions of the world. There's one node for each one of the region, one in Europe, in Sweden, one in India for Southeast Asia, for the all Asia Pacific region, one in Africa, in Zambia, and one in Latin America, in Ecuador. So this network is quite interesting because it's the one in charge of doing the translation from research into policy action. And I wanted to bring this work that I was able to make in the last months of my rotation in Sweden, where basically we wanted to highlight one of an important driver on antibiotic resistance. Which is the untreated discharges and the antibiotic production on the cycle of antimicrobial resistance. So what we did, or what is a policy brief, is trying to find the current state of the art of a situation, in this case, the antibiotic supply chain, and also breaking it down to policymakers, and also having recommendations or action point section where we actually call for those policymakers or stakeholders who are relevant to take some action on this. Summarize it a bit for you. The current situation that even though worldwide there's quite some policies, especially in high income countries, on how is the antibiotic production, for example, in Europe, which has some kind of strict regulations on the antibiotic production. Still, a lot of antibiotics are produced in other countries, actually, such as India, where regulations not necessarily are as strong. So there's a whole cycle where untreated discharges from antibiotic production comes into the environment and actually can reach into livestock and aquaculture, as well as crops and to humans. And in between them, there can be also this trespassing of resistant bacteria. This is a neglected factor inside antibiotic resistance, and some work that we did together with REACT was to break down the evidence, what's the current policies that exist, what's the publication said, and then bring some publication into the specific recommendation. So this is another pathway on how you can also, take the research you are doing into some tangible action. You can do this both in a local or national level, where you can also in an organization, especially because normally these are done, through a framework of an organization. You kind of do this kind of research where you're putting the state of the art and then this tangible recommendation. Quite short, shouldn't be super long. So from 4 to 8 pages. Which is ideally for policymakers. So this was just launched last month, and I wanted to bring this as an example of how other ways of doing research can be done. So coming back to my PhD topic, which is on vaccines, I wanted also to bring this example from one of a study on meningitis B vaccination. So as many of you might know, meningitis B is one of important cause for meningitis. And to put you in context of the situation in Spain until 2022, the meningitis B vaccine was not funded. It was self-funded by each of the families. And already research has been showing that children that did not receive the meningitis B vaccine were at higher risk of social exclusion. So the idea of this study was to check on the co-administration of the meningitis B vaccination in children, and also what impact has had the funding in this region of the Valencian community where I'm living. And the research was quite important because what it highlight was that meningitis B vaccination rates improve after funding, which is something that might be quite expected, and that also the coverage increased from 60% to over 95%. So having this kind of situations when you have a vaccine that is recommended but not funded by the public system also put this huge gap in equity, where those who have access to the vaccine actually are protected, but not necessarily are the ones that are at higher risk, because those families who are not able to fund themselves for this vaccine were actually in higher risk because of different situations such as the social exclusion, or for example, not having the full vaccination calendar, or being migrants, just to say a few. And even though this might be an obvious relation that once you fund the vaccine, then coverage will increase, and also and the protection for kids, it was really needed to have this kind of documents to actually guide policy action. So to put you in context, during my rotations here in my residency, I was also able to be in the vaccine department, where actually this kind of research were the ones that were also used to convince policymakers that the meningitis B vaccine should be also funded, not just because of the benefit that it will bring, but also because we were showcasing which big gap there was on equity and on social accountability, when we were seeing that there was a bigger exclusion from those who were most at risk. So actually, on 2023, it was then funded, but this kind of research also set the ground for other countries or regions in different parts of the world to actually use this into building a case whenever a policy change want to be implemented when we talk about public health action. About another of my research papers for my thesis was on the respiratory syncytial virus. So, as many of you might know, the RSV and the respiratory syncytial virus is one of the main causes for hospitalization in children in high-income countries. Spain was one of them for sure. And what happened is that during the season 2023-2024, Spain started a nationwide immunization campaign with a new monoclonal antibody, which is called nirsevimab. This monoclonal antibody acts as a vaccine, even though it's not a vaccine, for protecting kids. But why am I bringing this study here? So while I was rotating in the vaccine department in the Valencia region, we came into the situation that we already implemented this public health policy because it came from the Ministry of Health, but we were not really measuring what was happening or what was the impact that it was having. So mid-term of this campaign, what we decided was to do this effectiveness evaluation, where basically we were able to find that we had already almost 90% coverage of infants and 74 effectiveness on protection on hospital rates, as well as a threefold reduction on the RSV cases that needed to be hospitalized. So this is quite interesting because we were able to almost live show what was the impact that this new policy on vaccination was having. And for you to have an idea, this is the Valencian community. That is part of Spain. Is one of the biggest provinces in Spain, and it was quite relevant study because we were one of the first studies who were assessing the effectiveness of public health measures such as this nirsevimab with a population of 5 million people, which is the whole population of Valencia, with more than 27 children who were included in the study and 24,000 who were immunized. So other studies, such as one in Luxembourg, was also published, but as you can imagine, even though that study was countrywide, the population or the number of kids studied were not as big as even one of the regions of Spain. And I'm bringing this example because just to showcase how important it is, the first part of setting up the stage for your research, and as important it is to also what you do right after your study, because you have to think that whenever you're doing these studies, you should also include, this best practices and this application, so other regions in the world can actually apply this into their own health systems. It's true that nirsevimab is still quite new, even in the European region. It has been just implemented for a few countries, but you have to think that this kind of is setting the ground for later on the next immunization campaigns that would happen in other regions, and is setting also the baseline. So just wanted to showcase how one study that actually started because I was during my rotation, I took the lead on it because, as you can imagine, a public health department is fully with work. And I wanted also to, with this specific example, give you the message or the best practice that you can also take the lead in many of the rotations or once you're a resident to actually conduct research, because what it happens many times, they don't have the time. And as resident, you are in a key position to actually do research and publications. So now we've seen a couple examples of why it's important to create this bridge, and how some of the research papers that I've worked in has impact both in junior doctors on antimicrobial resistance and policy, as well as vaccination policies. So I wanted to bring some tips for you whenever you're doing research, and also I know that during this different day workshops you will have a lot, but for always keeping in mind this bridge that you have to build while you do your studies. But actually you have to start with the end in mind. So whenever you're starting your research, you should ask yourself who could use these results and how. And this is really relevant because when I was doing these rotations in public health, I realized when doing the research work, seeing from other colleagues what the research papers were published, you can really tell when a paper was actually done with this in mind. Because you will see that in the conclusion, in the discussion, and you will be able actually to take that from your research for actually building something from it. So step number one, trying to start with the end in mind of what people are going to use these results for, not just publishing for publishing, but actually those results where are going to be used and how it can be used, because that also will portray how you present these results. And as you're on your early career stage, I think this is really important to have in mind, because you will see the impact that your research can have. You invest so many hours in doing research. I'm the first one to know how frustrating sometimes it can be with lack of funding, doing this on your free time. But it's really important to follow this tip. The second tip that I wanted to bring you is it's super important to build relations. So whenever you're doing your research, or even in the process after your research is published or while the revision, it's important to talk to local health officers, administrators, patient or advocacy groups while you do your research, but also to know what would be the potential impact that your research can have. And this is key because this will also help, once you have your research published, to also facilitate this information to those who actually might be in a position to make decisions or to draft action into the field you're working. The number 3 tip is to have in mind the accessibility part and communicate accessibility. So I know this is a huge topic whenever we are talking about open access. Always, when possible, it's better to publish in open access. I know that many times this implies a cost for the researcher. It's funny because, especially for those who are from outside from the health sector, whenever you tell them that you're doing research, they're that's so nice. You're getting paid for this, and many people actually are surprised that not that you are not paid for doing research, but in many cases you have to pay for research. So I'm super mindful about this on the open access, but whenever possible, that is a must. And also trying to seek for other sources of funding. In many cases, it can be through a university. Some hospitals might have some scholarships intended for this. I'm not saying that it should go through your own pocket, because I've been there and shouldn't be a burden for you. But there's other ways in which you can also share these outcomes. So, for example, once you publish, and you should always review the policy from the journal that you have submitted, there's other ways to communicate your results. So, for example, infographics in many cases for social media, it's quite acceptable from journals. And as far as you are not putting all the information from your paper, but kind of the key outcomes, or even changing a bit the graphics or the results how you're presenting are a great way on after your research is published, how you're going to disseminate that information to actually those who need it. I've seen in social media that actually you can, for example, in X or in Blue Sky, you can create this thread with the main result once you publish. So that will give first visibility to your paper, which will also give you chances that more people use it and actually cite it. But also breaking this down will help us, find those research that are more relevant for us. In a world which we are hyper connected now in academia, so many papers are being published every day. It's really important also to make it as easy as possible. Also, doing the work as policy brief, as I was showing, also put the research into the hands of community leaders and policymakers. So make sure that you're also helping with your own study to translate it into action. So you're actually building this bridge in between the research and all the efforts that you put to get into those who actually work for the people. And the last tip is to consider equity. So whenever you do research, it's really important to think about the equity gap, which is also quite important. And I wanted to bring the example from Spain, that in Spain, the gender perspective is quite mandatory when you do research. It's quite encouraged, and actually various policies and laws put into place that whenever you do research, and if it's possible, you should always acknowledge the gender perspective as a minimum. Of course, there's other minority populations that you should also consider, but have in mind or put these glasses of equity when you're doing your research, because sometimes we might fall into seeing just numbers, and whenever we finally have published, even though there's peer review and different process for filtering, we should really from the beginning have quite some consideration on the equity part. Also, just to give you on these last minutes on some topics on the ethical part, even though I know you will have a session specifically for this. As I'm also from the World Medical Association Junior Doctors Network, I wanted to talk about briefly about the Declaration of Helsinki. Probably some of you have heard about it. It was created back in 1964 after Second World War II with the Nuremberg trials. As you might recall, this human experimenting were kind of the cornerstone for creating the Helsinki Declaration, which it's the guidelines for ethical principles on medical research and involving human participants. Even though it was created back in 1964, it has been updated over the years. And actually, it's quite interesting because last year, the World Medical Association, and I was honored to be on that meeting, on 2024, we updated the Declaration of Helsinki. So for those who don't remember, or just to refresh your minds, the overarching principle of the Declaration of Helsinki is that the health, the well-being, and the rights of research participants must take precedent over the interest of science or society. So not the result for science or the benefit for society comes for all. Always patients, participants must be on top priority. And also, something really important is the post-trial provisions. So participants, and by extension also their communities, should be the ones who benefit from the outcomes of research, especially if an effective intervention is discovered. And we see that this happens a lot with pharma industries having clinical trials in low and middle income countries, and then with those results actually creating drugs that are not accessible for those communities. So this is a really important point. Even though it's not binding at the moment, it's really important that it's already outlined there. And just to also mention some of the last updates from 2024 is that now this new version also strengthened the ethical standards in clinical research. So before the participants were called subjects. So in this new version, we changed it to participants to emphasize this autonomy and also humanizing the research itself. Also that now even though in the past we referred to the Declaration of Helsinki for physicians as the main researchers, it's true that nowadays is not the case. We have a lot of pharmacists, veterinarians, and other health professionals and not health related who are doing research on the field. So expanding also the scope of this declaration beyond physicians. Also to ensure fair inclusion of vulnerable populations. So, as you might know, most of the human research, as well as, for example, medical textbooks, are based on middle-aged white men, which means that there's a lot of gap of knowledge between other populations. So, it's really important to have this fair inclusion without vulnerating those populations. Promoting transparency, also with now such things such as big data, AI, and other new technologies to reinforce justice and equity. And finally, to ensure this ethical inclusion during public health emergencies as we live during COVID-19. And finally, I just wanted to tell you a bit more of where I'm also working and also how you can engage. So the Junior Doctors Network is the biggest junior doctor representative association or network in the world. We're part of the World Medical Association. Last census, we were over 1,000 from all over the world. As you see, actually, Asia Pacific is quite a big region for us, India being one of the countries with where we have most members. But yeah, this picture from our last meeting in Seoul 2024. Our next meeting is going to happen in Uruguay. And we are a network where, even though we don't do research per se, we are kind of the framework where a lot of junior doctors with their own work that they can be doing research as their primary job come together for working on global health. So we have different working groups, including antimicrobial resistance, primary healthcare, medical ethics, medical education. We have pandemic preparedness, planetary health. And in these working groups, actually, we bring the expertise from different junior doctors from across the world to actually push into action. So I won't go much into detail into this, but I just wanted to share this brief slide. If you want to know more about the work that we do, you can find us in social media as WMA /JDN. And also that any junior doctor in the period of 10 years from their graduation, which is our definition of junior doctors, can join for free. First thing is to be part of the WMA associate members, which is free on the first 5 years of graduation, and then apply as JDN. Also, medical students, I invite as observers if they're on the last years of medical school. So if you're interested and you see this global health work is interesting for you, I highly encourage you to participate, because we do serve as a platform for giving voice and actually advocacy using, of course, evidence-based and research. And with that I think I'm already over time. I will open the floor if there's any questions. So I'll stop screen sharing now.
If anyone has any questions for a speaker, you're welcome to type them in the chat box. And Rajvi ma'am will take up the questions. Over to you, Rajvi ma'am.
So I see that one of the questions from the participants from Alan Nasir that is asking also regarding AMR threatened surgical outcomes, especially in low and middle income countries. So the question is, what policy and implementation strategies can help AMR initiatives and global surgery efforts collaborate effectively to improve infection control and patient safety? And this is a great question because I've been working extensively also in antimicrobial resistance. And it's true that there is no one single measure, but there's a couple bundles or strategies that you can implement. So in the healthcare setting, for example, the WASH methodology, which also includes all the hygiene, the hand measures, the effectiveness on antibiotics stewardship, is key. So it's true that there's no one specific factor that is contributing to AMR, but it's important to have a national action plan, which I think India does, but also how it's implemented then in a local basis. When we talk about AMR, it's true that it's becoming one of the biggest threats in public health, and it's really important to tackle it from a multi-sector way. From the Junior Doctors Network, we're also part of the Quadripartite, which represents the World Health Organization, the Food Organization, and FAO. We have the World Organization on Animal Health, and we have the United Nations Environmental Program. So from the full perspective, we're talking about a One Health approach. Policies should be implemented. We saw that last year there was quite some political will on the topic. There was the United Nations high-level meeting on antimicrobial resistance that happened in New York. So this year still, some different initiatives ongoing. And from the youth perspective, I would say first research. A lot of research is needed. For a presentation that we're having on Thursday, I was checking, and there's actually quite some few researchers on AMR. There's a lot needed. So around 3,000 papers were published on 2020. So that's still a big gap. So a lot of research is still needed. And I see the second question on the research in general. In general, is largely male-centered, overlooking its impact on maternal health and post-surge infections. How can we bridge this gender gap in research and policy? And this is really important. I would say that the first thing we need to do is produce evidence. We need to create this new evidence addressing, how, for example, I think one of the most common examples when we talk about these gender inequities is the time since a person has symptoms of a heart attack, of cardiac arrest, until they go to the emergency rooms, is quite different between male and females. And you will say, why? It's because of the symptoms. Part of it, yes. So normally we've been taught in medical school the usual symptoms in males, but there's also another determinant that influence, that is, for example, the responsibility that women usually have with their families. So what it has been seen is that this difference also happens, that when a woman starts having this kind of symptoms, they first have to fix who they leave the kids, or if they have, for example, someone who is also dependent with them, who will take care of them. And one that is fixed, that thing is fixed, they will be able to go to the hospital. So it's quite interesting to also do this kind of research. So in many times, and especially with my experience in public health, I would say that we also need more qualitative studies. Quantitative are always fancier, brings more attention, but qualitative studies are also quite important, because this allows us to study other fields of medicine, which are, for example, the social determinants of health, which are key when we are trying to address a health issue. Because many times, and I would say that's a general issue in research, we are turning people into a disease or people into symptoms. While people have so many factors that affect their actions, their behaviors, they have their habits. So if you just study people as their illness, as their symptoms, you're actually missing a lot. So qualitative study is also a great pathway. If you haven't thought about it, it's also a great way for gathering this information. Okay, I see a question from Yousra. How can medical students build a strong research profile for future opportunities in organizations like WHO or WMA? So what my honest suggestion would be, first, that not trying to aim that your first research opportunities would happen in a high-level context with international collaboration or in places such as WHO, because I would tell you it's super hard. to start over there. And I would say actually the most impactful research is those done in a local level. So my biggest recommendation that I wish I heard it before during my medical school and even before starting residency is that you have so great tutors in your different rotations, in clinical rotations, once you start your residency. And many times we don't realize that there's an opportunity for research. Many of our tutors or the specialists who are teaching us have so many ongoing that they can't really be taking the whole research. So many times I would say that if you are actively asking those if they might have a research idea that they might need some help, this is one of the best ideas also to learn how to do research. Because I remember when I received this from my journal club class in medical school. Research is like learning how to swim. You will always learn, not in a classroom, you can learn the theory, but until you actually do it, you learn by doing. So the best way of doing is also by acting. So that would be my recommendation. Okay. So I see a question from Manojit. To start with the end in mind, is this possible in case of small-scale studies? One that young medical students are encouraged to do first? Definitely. I would say that this is a quite important topic because those smaller studies are actually the ones who build the basis for this big study. So whenever you see one of the top in evidence, one of the top manuscripts, which is a meta-analysis, you would see that the core of those studies are actually these little studies that you will actually take, from one that you will be making in your school. So I would say that it's still important to have the end in mind, especially whenever you're doing this research, just to be clear what is the main outcome. And even if it's something super specific that you might not be super sure how is the impact of that, make sure that also how you present the results are actionable. Because once you're writing that paper, you're becoming quite knowledgeable about the field. And then we fall into the trap of thinking that the others we're going to read are having the same background information as us. And it's not necessarily the case. Okay, I see another question that Simran is bringing. How can medical students actively contribute to research that impacts global health equity? So I would say that even the first step before research, because research is really essential, would be also, to get this capacity building on the first steps of global health, because it's really hard to make research on something you're still not fully aware. So I would highly, highly encourage you, those who are not that familiar with such concepts as I was telling you, as social determinants of health or commercial determinants of health, which is also how the different markets, such as the tobacco industry, alcohol industry, food industry, influence the decisions we make on a health-wise. So I would say first, even before research, is to kind of understand the importance of that topic. And once you're understanding and so on, then you will have a better background. Okay, this is the research question I want to solve. Because if you start also directly from the end, what I say from the end is not that already going to the results, or trying to get the results without all the previous work. What I mean is having the idea that whenever you are going to put a published paper, you have to be aware how it's going to be translated into others. Okay, I see the other question, how to drive change through our... Oh, I missed the question, sorry. There, how to drive change through our research, who should be our stakeholders. And this will change a lot because as you saw, it's quite different regarding the field of research. If it was about working conditions, as I show you, the stakeholders were much more from the National Medical Association, for example, or it was also the Department of Health from the country. But if, for example, if we're talking about vaccines, that was the case, stakeholders would be different. In my case, that was directly policymakers on the public health agency where I was working, as well as, for example, industry, directly vaccine producers. So I think it's also important, as a second step, also to think on this stakeholder mapping, whenever you also want to drive impact from your research. Okay, I see a couple more questions. So how can power imbalances between high income and low income countries be addressed in global health research? And this is quite important topic because we see that also the contexts are quite different. I was showing you before the nirsevimab for respiratory syncytial virus. And I think that's a good example on how we have to be really mindful that at the moment, for example, the translation from that public health recommendation might not be universal to other countries, mainly because when you're already struggling to give access to measles vaccine, just to give one example, probably the nirsevimab will not be a top priority. So I think we first have to acknowledge these differences, but I think we can also work them around. Because once we have completed, I see this as levels. So once you have, one of the basic levels, let's talk about vaccinations. Once you have the core vaccines already covered and you see that the vaccination are taking in place, then you can jump to the next level. And there is where research also helps, also identifying which should be the core vaccines, just to put an example. So yeah, I would also recommend to go by steps. Okay, I see here a comment from a first-year student from India. How do you suggest I approach conducted research on AMR? Given my access to internet resources, professors, and community input, what strategies or methodologies would be most effective for a beginner like me? I will try to quickly get actually a workshop that we are giving on the 27th. I'll share it over here in case you want to participate. So I would say that you need to find, of course, resources where are accessible to you and your context. And in many cases, one of the biggest issues that we have is there's so much information out there that it's really hard for us to digest, which are the most relevant. So let me specifically for antimicrobial resistance in this organization that I was working, which is called REACT, they have this tool, which is called the toolbox. Let me share over here. And this is a great tool specifically for antimicrobial resistance, which helps you go through the different steps from the understanding basic concepts on antimicrobial resistance, from how the classification of bacteria, on antibiotic resistance, what are different ways of gaining resistance from mutation, from transfer of antibiotic resistance with genes, plasmids and co-selection, among others. And then you have also other sections such as race awareness. So I would say it's also key to find this kind of resources that are useful for you. Okay. I think we are all already over time. I see in the questions. So yeah, I'll give it back to the organizing team. I want to thank again for the space. It's really an honor to be in this kind of spaces, and I congratulate, because I think this is one of the first steps that we need when we want to strengthen research, is actually giving students and early career researchers this opportunity. Let me just quickly find the link for this workshop if you still want to register. And feel free also to reach out with any other questions.
Thank you so much, sir, for your insights. I would like our National President, Abhishek, sir, to give a thank you note to you. Over to you, sir.
Hi, Dr. Pablo. How are you doing? And firstly, thank you so much for giving your time, and the students that we have. They were really, excited to have you here, and also you are an inspiration and for a lot of medical students and junior doctors. All the achievements and from where you have, brought up the challenges, and you came up and you are still, taking care of all the challenges that we on global scale. But I would say that, for students, those who are interested in research, we designed this course that is for the students, and we really wanted to create an ecosystem where, and a community as well, so that the students beginning from the first year of medical school, have that basic idea of research methodology. Apart from that, Dr. Pablo, there were certain things I really wanted to discuss, and I think this is a a apt time to, you have seen how we function and the potential that we students here in India have. Since India has a lot of youth population, and when we talk about the youth population, we and we talk about the CRO region, we feel that the global South is well underrepresented on the global platforms. So how do you think that how we can enhance our global presence, since we have an organization but we still lack a lot of, there's a lot of bias, there's a lot of geopolitics, and there's a lot of variables. How, as an organization, how a group of medical students from India, and I believe we, as medical student organization, our organization is one of the one of the largest organizations in India, and still we lack representation, and a lot of voices from various part of India are not heard on global platform. So how we can enhance our presence on such global platforms?
Definitely. Thank you so much, Abhishek, for your kind words. Yes, I think this is a really important question that I've also struggled with this question, coming from Ecuador since I was a medical student. And I found my way through here. And actually, all of you who are here are on the right path, because I think like through communities, how you can actually, combat these inequities and this imbalance in power. As you see, like especially the global South is quite underrepresented. Just to put you an example, in the Junior Doctors Network, I was the first Latin American chair that ever from the history of the JDN to hold this position. And I'm also trying, to close these gaps. I think now we're in a lucky position, considering the whole situation still, where technology are actually bringing us together. I mean, like having this opportunity for me, like from the, from my room, well, now at the hospital, but from Spain, also being able to connect with you is quite a great opportunity, so using technologies, also being part of this kind of networks. I know different organizations are collaborating for this, but I think this is what actually connects people, and those who are participating today will also find that you have similar interests, similar inquiries, and similar motivations. And I would say that's what drives you further. So it's true that sometimes when we are on our early stages, we're like, okay, I'm not really sure how to take it from here. But I can tell you, I've been in your steps. Whenever I was also one day that medical student from Ecuador that was, okay, I want to have some kind of global impact. Where do I start? And it's really hard, that question, because you don't know where is the first step, right? But I think like being able to take it step by step, being, one of the questions we're asking, I think the first is to have a strong build of knowledge, because something that I've realized also in public health is that then you have a lot of policymakers who are not necessarily knowledgeable about what where they're treating about, and even though they have a lot of power for decision making. And I think that there's the role of health professionals, where we are actually able to bring that evidence for those who actually can take some action.
Thank you, Dr. Pablo, for answering such, beautifully. Like, you really pointed out the core challenges that we face, and since you've already gone through all those challenges, you really understand the actual reality of it. But when you told that, policymakers, they don't have, sort of knowledge and the real field thing, I feel we have a network, and since you are in a position where you really can guide us and you have that experience in any way, JDN can, help us. Maybe we could come up with some course or some sessions where medical students can participate, and they can work on capacity building, and get equipped with how these global platforms function, and what actually, they understand the meaning of policy statements, and what is and how research can be translated into such thing. So if we could have certain sessions or certain capacity building workshop for students, then we would really like to collaborate with JDN, and see
Sure.
how medical students are well equipped with it.
Give me just 1 second. Sorry for that. Yes, and about this question, I would just mention that even though the junior doctors also welcome as observers those students that are in their last year, I would say that um, also the going by steps applies in here, because junior doctors also, it's true that we have other priorities compared to medical students. Just to give you an example, when because I've worked a lot also with medical student organizations, their priority is not in health workforce. So whenever you talk to students as they're not working yet, it's true that, for example, working conditions, the health workforce migration, and so on, is not still a topic that is that close to the topic. Probably to those who are closer, like in the last year, that they see this coming. It's true that most of our activities are mainly for members. Some of students can also come to observe, but I think like our main core has been, as we are also a global wide organization, we can't really, specifically work with, continually with one specific country. So what we actively encourage is also this cross national collaboration. So for example, for medical students in India, try to collaborate with your junior doctor association, that I know that it exists, that we work closely with them from India. And I think that that nexus are the most valuable, because I can tell you, like, a specific project at this can give value, of course, as one moment and one interaction. And of course, I think like this will open the bridges for other kind of opportunities. But I think the key and the most sustainable kind of approach is with the national junior doctors, where actually, there's the next step. Once you finish medical school, most probably those who are really active will want to still stay in their national junior doctors association.
Thank you, Dr. Pablo. And at the end, I would really ask everyone to have turn on the camera so that we can have a group picture, and then we can end this meeting.
Great. Also, nice to see you all. What a pleasure, really.
Hi, Pablo, Dr. Pablo. Thank you for coming. And calling. Am I audible? Sir, am I audible?
Yes, now I can hear you.
Thank you for accepting our invitation and coming to our groups. I have just one question, that AMR is very like it's a global topic now, because recently it has been told by the mortality due to AMR will cause cancer also. So, is there any plan from WMA to make some like country was wise AMR hub, like the India hub, Bangladesh hub, or like the country wise hub? Is there any planning, in future planning from the WMA side?
Yep. Thank you for your question. And to briefly, because also is not under my competencies from this work from the WMA, but WMA doesn't necessarily work on this. They don't have the competencies for actually creating hubs, but to support, again, their national medical association. So in this case, it would be the India Medical Association, and their own support. So yeah. If you're interested in the topic, actually, great that you remind me. I just put it on the comments as well. This workshop that is going to happen this Thursday, quite interesting, because we're going to talk about different tools on dealing with antimicrobial resistance. I'll be doing it with a colleague from India, actually. So yeah, if you're interested, I'll encourage you also to register, and we'll see each other on Thursday.
Thank you, Dr. Pablo. Abhishek, is there any final remarks from
Thank
your
you,
side?
Dr. Pablo. Thank you, Dr. Pablo, for your time. And we'd like to end the meeting and really it was such an insightful session. And I hope we could have more such sessions where you have some time and you can discuss few more topics for our medical students in India. Thank you so much.